I don't know. Hi, everyone. We'll start here in about 1 minute, right on the clock. All right, so it's noon. Hi, everyone, and welcome to our webinar, Understanding the Medicare Alphabet. Our goal of the webinar today is really to give you a real brief 101, really just give you the information you need to know. There's a lot more we could cover on the nuances, but I wanted to give you what you need to know, but really quickly dive into some of the key decisions you'll be prepared to make, as well as lend some of our perspective on some real life case studies. We've seen this be really important as you navigate the Medicare decision. Also wanted to give a quick, we'd be remiss if we didn't give a quick thoughts and prayers to all our clients, friends, family, and colleagues in Florida right now. Thank you for those who have reached out to us, and please continue to do so and let us know if there's anything we can do to help. As we get started, one quick disclosure before we dive in. We are not Medicare agents and do not sell Medicare products. Our job as advisors is to help our clients understand the Medicare system within their personal financial plan. We'll be walking through some examples in this presentation for illustrative purposes and to show the important elements and complexity of the Medicare decision. We encourage you to meet with an advisor to discuss your specific circumstances. So now that we've made the lawyers happy, we'll dive into the presentation, and Tom is going to kick us off and take us through a little bit of a 101.
Yes, thank you, Eric, and thanks everyone for joining us today on a very important subject matter. As you know, our health, our management of our health, and the decisions around healthcare expenses are critically important to a financial plan. So we're happy to be able to talk about the subject of Medicare today. The Medicare alphabet, let's just dive right in and talk about these different parts. So Part A is hospital insurance, pretty self-explanatory, and this is in traditional Medicare. Part B is medical insurance for doctor visits and the like. And then Part D is for prescription drug coverage. All three of those parts are in the traditional Medicare world. You can also opt for Part C, which is a Medicare Advantage plan. Doug's going to get into the specifics of that. One is managed by the government, one is managed by private healthcare and subsidized by the government. So as I just mentioned, so under traditional Medicare, you're getting your benefits directly from the federal government for both Part A and Part B. In Part A, we're talking about inpatient hospitalization, skilled nursing facilities, home health care, and hospice. And many people confuse the skilled nursing facility benefits and the home health care with traditional long-term care. These are limited benefits, and so we don't want clients to confuse the two. If you want long-term health care, that's a separate coverage. Under Medicare Part B, this includes doctor visits, other medical providers, preventative benefits, such as well care benefits and the like, and then durable medical equipment, and then outpatient services. And Part D, now this is not directly through the federal government. This is a private program that you get through a private insurance coverage. There are many different plans. They have varying premiums, deductibles, copays, and formulary lists. And so that's one decision point, not only in your original decision to enroll in Medicare, but on an annual basis, you're going to want to look at that. And again, Doug's going to talk a little bit more about that because it is critical that you manage that on a yearly basis. So then, as I mentioned before, the first A, B, and D are part of traditional Medicare, or you can opt for a bundled solution that is managed through private insurance that is subsidized by the federal government. And then in that particular instance, all three parts, Part A, B, and D, are included in the coverage for the most part. There are noted exceptions on Part D, but for the most part, you get all three. So what does the enrollment process actually look like? When you enroll in Part A and B, you do so through the Social Security website, ssa.org. Or if you're already receiving Social Security benefits, that enrollment is automatic. There's basically three ways you can enroll. You can enroll online through the website I just mentioned. You can enroll in person at a Social Security local site, or you can do a physical application and you can fax it to your local Social Security office. So when do you start? You can start as long as it's 3 months before the month of your birth date, the month of your birth date, and 3 months prior. So you've got a 7-month window to start the enrollment process without penalties. So for example, if you look here, if you turn 65 on May 20th, your initial enrollment would run from February 1st to August 31st. If you get outside of that window, then you're subject to penalties for future premiums. As a practical matter, when you go to enroll for Medicare, you're going to put in the enrollment date you want to start. Typically, it's going to be the month of your birth date. If your birth date is on the 1st, then it's going to be the prior month. And if you delay the decision, then Medicare will start on a delayed basis. So let's get into a little bit of the cost of Medicare. So Part A is free if you've got a work history of 40 quarters or 10 years. You can also qualify on your spouse's work history if you've been married for at least 1 year. And there are special rules that apply for divorced and widowed individuals that emulate the Social Security rules or the 10-year rule. So as far as the base premium for Medicare, for Part B, in 2022, the monthly premium is $170.10. New premiums just came out 2 days ago for 2023, and they're actually going to be reducing the cost by a few dollars to $164.90. We talked about that internally, that there was they had reserved for an Alzheimer's drug that ended up not being as much as they thought it would be, and this had an effect on it. And apparently there was a little bit to do with COVID as well. But the good news is, in this time of inflation, we're actually getting a little bit of a relief on Part B. On Part D, again, this is an individual insurance choice, so you have the choice on which plan you choose. And typically in 2022, that ranges between $7 a month to as much as $205 a month. Now there's the Social Security base is there for everybody, but then for those who are of higher incomes, there's a means test for these premiums. It's called the Income Related Monthly Adjustment Amount, called IRMA. And in IRMA, the additional premiums start at $91,000 for individuals, and go back a slide there. Yeah, and $182,000 for joint, and that's based on your modified adjusted gross income. So if you look at the chart, you can see that the range of premiums go up as high as $578.30 per month. When you calculate this IRMA premium, or when the government calculates this premium, they do so on a 2-year look back. So it's always behind. And I know for myself, when I signed up for Medicare recently, I got at least 14 letters changing my premium amount. So it's a very dynamic circumstance, and it's something that you're going to have to go through a period where they're going to adjust. You can also petition if your income is radically changed in a given year to see if you can petition for a lower IRMA premium. Same thing goes for Part D. In Part D, which is your drug plan, the IRMA premium goes from your base premium all the way up to $77.90. This will be assessed at the same place that you get your premium, your base premiums done.
Wonderful. And with that, we're going to kick it off to Doug to kind of get into some of the decisions you're going to have to make. I forgot to note at the top, if you have any questions, there is a Q&A tab to add some questions throughout the process, and we'll try and get to those at the end. And if we happen to not get to them, we will reach out individually to those who ask those questions. So with that, Doug, let me switch the pin over to you and go ahead and talk about this decision. Sorry, Doug, you're muted.
No, I'm unmuted. Thank you. So this is the big decision. The decision you make when you enroll for Medicare is critically important, because some of the decisions you make at your initial enrollment period, you have either no ability to change or very limited ability to change. So what I'm going to discuss is the differences between traditional Medicare with a supplement and Medicare Advantage. As Tom explained, Medicare Advantage is a program that the government started years ago, Medicare did, and they basically have gone out to private insurers, those same insurers typically that do Medicare supplement plans, and they offer different programs under the Medicare Advantage, and they cover your hospitalization, they cover medical physician costs and the Part B costs, and a lot of them, or most of them, have embedded Part D prescription drug benefits. But it's important you understand the difference when you make that initial election. So under traditional Medicare, which is Part A and Part B, as Tom discussed, you have coverage, which we'll briefly look at. And then to cover what Medicare doesn't cover, you can apply for and get a Medicare supplement. And basically that covers your portion of the cost that Medicare doesn't cover under A and B. And then there's Part D, which Tom again talked about. We'll look at that in a little more depth. Medicare Advantage plan is going to be more like a traditional HMO or PPO, and I will explain the differences. The biggest part is who's the gatekeeper and what are the costs. So typically with traditional Medicare, Medicare Supplement, and Part D, you're paying a little bit more for the cost of the insurance, and you have very little out-of-pocket cost for anything other than prescription drugs. Whereas a Medicare Advantage plan, you have lower premiums, sometimes zero. But you're going to have copays for doctor visits. You're going to have copays for hospitalization, emergency room visits. You'll have out-of-pocket expenses up to a maximum out-of-pocket limit. So you'll generally, if you have medical claims, any level of medical claims, you'll spend more on your health care under a Medicare Advantage plan, but you'll spend less on your out-of-pocket premiums. So traditional Medicare, as Tom explained, is Part A and Part B. And your insurance company is essentially the government. And they leave the choice under traditional Medicare of the treatment protocols to you and to your doctor. That is a control element that a lot of people enjoy when they go into Medicare. Eric, flip forward. Part A, real quickly, is the hospitalization part, as Tom explained, and I'll go through these quickly. All these slides will be available. Part A deductible in a hospitalization is $1,556 deductible. The Medicare Part A pays the entire hospitalization bill for the first 60 days. On day 61, you have a copay of $389. On day 91, you have a copay of $778 using up something called reserve days. And I won't go into the detail of all that. These are just important things to ultimately understand. And then it also picks up a big portion of your skilled nursing facility if you are hospitalized and then you need to go, let's say, a hip replacement or a knee replacement. You need to go to a skilled nursing facility for rehab. Then your Medicare Part A would provide some benefits under that portion of the policy. Part B covers essentially everything else. Part B deductible is $233. And then all the costs above that, preventative is fully covered by Medicare. And then any other expenses, your doctor visits, your specialists, lab tests, x-rays, MRIs, CAT scans, and inpatient, hospital or Medicare provider provided medications like chemotherapy, those are covered under your Part B. And Medicare pays 80% of the cost of those services. And if you don't have a Medicare supplement, you're liable for 20%, the 20% portion out of pocket. So that's where you would take on a Medicare supplement. And a Medicare supplement is an overlay that you pay extra for, and that covers what traditional Medicare Part A and Part B don't cover. The nice part about traditional Medicare with a supplement is you can choose any provider that accepts Medicare, which is essentially in today's medical world, everybody. There are a few exceptions to that. You need virtually no prior authorizations. There are a couple, but if your doctor determines you need a CAT scan or an MRI or an extra night in the hospital, for the most part under traditional Medicare, that's a decision that your physician makes and does not need an insurance company approval or prior authorization. There's a Medicare supplement alphabet that we'll look at real briefly. But for the most part, today, most people will enroll in what's called a supplement plan G. Every plan G is identical and has the same benefits, and it pays essentially all of your expenses that Medicare doesn't cover, both for hospitalization and your 20% responsibility for Part B is all covered by your supplement. So you essentially have no out-of-pocket except for the $233 Part B deductible. As I said, there's a real wide availability of, can you step back one, Eric, please? There's a wide availability of Medicare providers, so your choices are almost unlimited. And these policies are issued by, the supplements are offered by recognizable names: Anthem, United Healthcare, Aetna, Mutual of Omaha. There's a wide number of plans that are available. The difference is between them is virtually non-existent. There's a difference between a Form F and a Form G and a Form N and a Form A and B, but all Plan Gs are essentially the same. For those of you that enrolled in a supplement in prior years, more than 2 years ago, you may have a Plan F, and Plan F is essentially identical to G. The only difference is if you were grandfathered into Plan F, which is no longer available to new enrollees, Plan F even covered the Part B deductible. Congress, in its infinite wisdom, and Medicare wanted some skin in the game by insured, so Plan G requires that you pay the $233 out of pocket. So traditional Medicare, really for medical services, you have virtually no out of pocket under that option. Now, it's important that you understand how a Medicare supplement works, because enrollment is critical. At the point that you enroll in Medicare Part B, And Tom explained when the open windows are. You apply when you turn 65 is when you become eligible for Medicare. We'll cover briefly, probably in the question section, late enrollment. You may be eligible for a special enrollment period, at which time you can enroll in Part B later without it being considered late. But once you enroll in Plan B, you have 6 months within the effective date of your Plan B to enroll in a Medicare supplement without any medical underwriting. So that is the only time you can enroll is in your open enrollment period or your special enrollment period, the first 6 months after your Plan B is effective. So that is why that's a critical decision when you first enroll in Medicare Part B. You also have, this touches on the guaranteed issue period. If you are covered under an employer provided plan and you lose that coverage, there is another window that allows you to enroll in a Medicare supplement without underwriting. Otherwise, if you try at some later date to enroll in medical underwriting, and we'll discuss Medicare Advantage and supplements and switching back and forth in an annual enrollment period, they are going to ask you the typical medical questions. Have you had any health conditions? And you're going to have to go back and disclose medical information, and they have the option to not provide the coverage at the normal cost for a supplement. So that's a critical element to know as we get into switching. So I mentioned real briefly, I won't go into the details here. This is the Medigap, and Medicare supplements are often referred to as Medigap policies. It covers the gaps of Medicare. Plan F was the most prolific plan, most widely adopted. Plan G is now the most comprehensive plan, and the only difference between the two of them is whether or not it covers the Part B deductible. And so they're essentially the same, and those are the ones that I would say 90% of the people in Medicare supplements have Plan F or Plan G. But there's all kinds of different plans that have been available, and some are still available. Medicare Advantage. So what is Medicare Advantage? Well, Congress figured out and Medicare figured out that they don't do a particularly great job at being gatekeepers. There's a lot of theories on, we know Medicare has more money going out than it has coming in. And so how could they help control the costs of Medicare claims as we have an aging population, 10,000 people a day turning age 65. So what was adopted as a Medicare Advantage, as Tom explained, that's Medicare Plan C. And what happens is you still pay your A premium, your A is free. You still pay your B premium, Plan B, even though you're not covered by Plan B. And in turn, Medicare pays a per capita rate per person to the insurance company. So Humana, Aetna, Blue Cross, Anthem, United Healthcare, they pay the insurance company to manage your claims. And Congress has a target of moving 80% of Medicare beneficiaries over to Medicare Advantage. And the fact is that they want to help of private insurance companies to control costs. Medicare Advantage often includes or has embedded in it a Part D coverage or prescription drugs. Those benefits are essentially the same as if you had your own Part D plan with traditional Medicare. And as I said, you must be enrolled in both Part A and Part B. So in a Medicare Advantage plan, you are paying your $170 premium in 2022, $164 next year. Okay, so how does a Medicare Advantage plan work? First of all, it operates typically under an HMO or PPO plan, much like you might have had in an employer-provided plan prior to going on Medicare. The plan management or cost management comes in that many of the medical services that are available or offered require a pre-approval. They do two pieces. They negotiate rates with a provider network. So whereas in traditional Medicare, you can go essentially anywhere that takes Medicare, under Medicare Advantage plans, there is a network provider list, and to get full benefits, you have to go to the network providers. In some cases, like an HMO, there are no or very little out-of-network options. If you don't go to the provider in the network, you're not covered. Under PPO plans, under Medicare Advantage, there may be limited out-of-network benefits. They may not cover as much, or if an out-of-network provider will take what the plan pays, in some cases you can go to an out-of-network provider. But your choices are somewhat reduced. In an HMO, they're substantially reduced. In a PPO, a number of the Medicare Advantage plans have larger networks. So there's usually quality providers in that group, but you are sacrificing choice in a Medicare Advantage plan. The other thing about Medicare Advantage is because you're in provider networks and you have a schedule of benefits, they change or can change every year. So each year you have to look to see what your benefits, what benefits the plan is covering, what the deductibles, what the copays are. Has the provider network changed? Is your doctor in the network? Those change annually. And so you have to pay attention to that every year when your new materials come out prior to the annual enrollment period. The nice thing about Medicare Advantage is there are no health questions, either when you initially enroll, or you can switch Medicare Advantage plans every year in the annual enrollment period. So there are no medical questions. You can switch from one plan to another. So if you elected one when you turn 65, and at 67, your doctor goes out of one network and is in another network, or the hospital closest to you that you would want to go to when out of network, you can switch plans from one to another. The Medicare Advantage plans also throw in trinkets, and this is a big profit area for insurance companies. So if you look at companies like Humana, this is one of the fastest growing areas of profitability for them. And in order to attract people to the Medicare Advantage plans, they'll throw in gym memberships, they'll throw in dental benefits, limited dental benefits, I will say. They'll throw in, they might say you get discounted hearing aids because currently Medicare, traditional Medicare has no coverage for hearing aids. Typically we'll see if you buy from our provider, you'll pay $2,000 instead of $6,000. They're discount plans, and in most instances you have to buy from their designated provider. In most cases, when we're talking with clients, to get similar pricing, you just go to Costco. So they offer those. And recently, it was just announced that they're going to allow hearing aids to be sold over the counter. So again, you have to decide that with your doctor, whether it's appropriate or not appropriate, but prices are likely to change. As I said earlier, Medicare Advantage, many services require prior authorization. And I'll step through some personal examples in a little bit later. The nice thing about Medicare Advantage, we talked about the Plan G on a Medicare supplement. That runs roughly, and it depends on what county you're in or what state you're in. Plan G runs about $125, give or take. It depends on the company. When you turn 65, and Plan G premiums go up a little bit every year based on age and based on what changes take place or inflation. Medicare Advantage plans typically have lower premiums. You can actually have a Medicare Advantage plan with no premium. In fact, in 2020, a study of Medicare Advantage plans, 60% of people covered under Medicare Advantage had a zero premium plan as far as the payment made to the insurance company. You still paid, as we said, your Medicare Part B premium of $170, but your premium for your Medicare Advantage benefits is goes anywhere from zero to probably 100 and Tom, what do you think? $150 or so, I think is the high end in our area. And it's just a combination of what the deductibles are, the size of the networks, what they've been able to negotiate, HMO versus PPO, there's a lot of moving parts there. So issues to consider with Medicare Advantage. Plans change every year and benefits can be added or taken away in any given year. So once you're in Medicare Advantage, you've got to keep track of what your plan covers. Does it still have your doctor? And you may have to change plans in any given year during your annual enrollment period, which we'll talk about. You have to be careful about reviewing this information because you may get a surprise. You go to your doctor in January and your doctor says, oh, I'm no longer in that network. So those are important to keep track of. The other important decision with Medicare Advantage, you can switch back from Medicare Advantage to traditional Medicare in an annual enrollment period. Most people who are in Medicare Advantage that would want to go back to traditional Medicare would be because they had high medical claims or a medical condition and they wanted more flexibility in the choice of their care provider. The problem with that is that to go back from Medicare Advantage to a supplement when you're not in your open enrollment period that we talked about within 6 months of starting plan Part B, you have to go through medical underwriting. And so for people, as we get older, our medical conditions change. We might have an acute medical condition. Once you've gone to Medicare Advantage, the chances or the opportunity to go back to traditional Medicare and with a supplement is very, very difficult. And I would never plan on being able to do that. So once you go Medicare Advantage, you're almost stuck in Medicare Advantage. And that's important to understand. And if you have questions around that, we can get that in the Q&A section. Enrollment periods. So these are important to understand. And with a Medicare supplement, you have to enroll within 6 months of your Part B effective date. That's when you can have open enrollment and there are no medical questions. As I said, that happens only one time for most beneficiaries. In the annual election period is that period that anybody remotely close to the age of 65 or over gets inundated with mail. You see people with signs out in the front yard if you're driving up the commercial streets about Medicare enrollment. That is the annual enrollment period from October 15th to December 7th of every year. You can change your prescription drug plan. You can change your Medicare Advantage plan. And you can actually change from Medicare Advantage back to traditional Medicare or vice versa. You can go from traditional Medicare to Medicare Advantage. The challenge with the move from Medicare Advantage to traditional Medicare, as I said, is getting a supplement. If you have any health conditions, then you have to go through medical underwriting, which may impair your ability to get a Medicare supplement.
Wonderful. Well, thank you, Doug, for walking us through that piece of it. Now that we've gone through some of the information, we'll get to some later as well, but really wanted to dive into some real world scenarios. So was really going to pick Doug and Tom's brain about a couple different scenarios we've discussed for real life that might be applicable to as you think about how you're going to use this coverage. So Doug, I'll start with you. As you just went through traditional Medicare with supplement versus Medicare Advantage, when you have a client or a family member who has gone through the hospitalization event, is there anything you can share with us on choice of care as it revolves around supplement versus Medicare Advantage?
Sure, Eric. So in our role as planners and working with our clients and families as closely as we do, sometimes it's with parents, helping clients out with their parent situation. We get involved, I would almost call it medical advocacy and helping to navigate, because a lot of people, especially parents, have made these decisions and they weren't fully aware of the circumstances. Now that Tom and I are further on in our career, now it's our contemporaries and our friends and clients that are us. Or us in Tom's case. Believe it or not, he's old enough to be in Medicare. So anyway, it's the options that are available for the care that you want or need that really, to me, separate Medicare Advantage and traditional Medicare. And while I would never disclose anybody's personal health situations or circumstances, I do have the permission from a couple of family members to explain, an example of what happens in Medicare Advantage versus traditional Medicare. And I'm going to use real quickly my mother. My mother recently fell and broke her hip, and she was carted off to the hospital by ambulance, and she had to have a hip replacement. She was in the hospital for 6 days with the hip replacement, and we had no pre-authorization. Everything was covered. She had zero out of pocket. She didn't pay a penny for her hospitalization, for her surgery, for any component of it. She's in traditional Medicare with a supplement. Then we came time for she needed to go to physical rehab. And we started searching around about what was the best setting for my mom to get rehabilitation, to get physical therapy and occupational therapy. And we decided that the best option was for her to go to an inpatient rehab facility. For those of you here in Cincinnati, it was at Mercy Fairfield. But they didn't have an open bed. And we didn't, the good news in that is that because she had a Medicare supplement, we didn't have to get any approval from the insurance company for her to go to that setting for the quality of her physical therapy. But we did have an issue where she needed to be there in the hospital one more night till a bed opened up at the inpatient rehab facility. So with her doctor, based on her doctor's assessment, he said she needed another night in the hospital, which then allowed her to be moved to Mercy, where she got 3.5 hours a day over the next 20 days of occupational therapy and physical therapy, and actually came out of the physical therapy better than she was before she broke her hip. And again, she had no out-of-pocket costs. We had no prior authorizations. We had all of the choices available to us as far as the rehab facility. We weren't left dealing with an insurance company who wanted to send her to a skilled nursing facility where she might only get an hour a day of physical therapy, because the Medicare Advantage plans have providers, skilled nursing facility providers, and they have to approve the physical therapy, whether you get physical therapy at home and they come visit you, or whether you go to one of their skilled nursing facilities that are part of their plan. We had all options available to come out to generate the ideal outcome. On the other hand, my father-in-law was recently had some abnormal medical tests, and the next protocol in those tests was to do a CT scan. And the doctor sent in all the information to his provider, and the insurance company in this case was Aetna. They declined to approve his doctor recommended CT scan to determine a very important component of his diagnosis. So we had to wait another week, and with the help of my wife and their medical providers, they had to file a whole appeal, which could take up to 60 days for review with Aetna. Ultimately, they relented and approved for him to get the CT scan. But that is the difference between cost management, right? And the control of the medical decisions under traditional Medicare largely, and with a Medicare supplement, are left to you and to your physician. Under Medicare Advantage, you have the intervention of, or the approval required of an insurance company. And so I think it's very, very important. A lot of people figure at 65, well, I'm healthy. I don't expect to have any medical issues. And a Medicare Advantage plan doesn't cost anything, as opposed to $120 a month for a Medicare supplement. I think you need to give careful consideration, and we sit down with every client in this circumstance and talk through this decision, because that choice can become critically important in the outcome that you achieve if you have a medical condition. And a lot of them aren't going to happen for 5 years, 10 years. None of us know at this point what the future holds. But traditional Medicare with a supplement gives you the maximum number of options. And if you have medical claims, while there's a cost differential, if you're in Medicare Advantage, you're paying a portion of those medical expenses through copays. And in traditional Medicare with a supplement, a Plan G, as I mentioned, you have virtually no medical care. My mother, as I said, had a hip replacement, 20 days in a inpatient rehab facility, and had zero out-of-pocket costs. So it's just a matter of how you're paying it. The other component is we don't know where Medicare Advantage premiums will be in the future. Congress has to approve every year the dollars going to Medicare Advantage through CMS. And so we don't know where that will be in the future. So there's no guarantee that those will necessarily be cheaper 5 years, 10 years, 15 years from now. So that's kind of a personal situation.
Yeah, thanks, Doug. I think that's really important. One quick, we got a Q&A during that. The situation with Doug's mom, my grandmother, was traditional Medicare with a supplement, and the Medicare Advantage coverage was with my grandfather, and you could see the differences of care. I think that's important to note. As people talk about, oh, I have the best Medicare coverage, every situation is different. And while some people view it as my premiums are lower than the next person, when these catastrophic events or real life happens as you age and medical events come up, the choice is really important. So it's a bigger decision than just, hey, what has a lower premium for me as I'm looking at this. Tom, next question for you. As one of our resident Golden Buckeyes, you recently went through the Medicare enrollment process and selected your coverage, as well as some of the benefits that come along with it, like the gym memberships and things like that. Can you walk us through some of the nuances of your process, what you experienced, any hiccups, and just give us your experience?
Yeah, thank you. So I would say that I had the dubious honor of applying for Medicare right in the middle of COVID. So systems that were probably better in place were completely disrupted. So the experience for me personally was extremely frustrating. Hour and a half holds to get a 2-minute question answered. A lot of flubs with the process itself. And in my particular instance, I was going from a large company plan to Medicare after I was 65. So there were some complexities there that they were not clear about that kind of held up the coverage. So that was extremely frustrating for me personally, but I would caution everyone to be patient in this process. And again, you read the disclosures, Eric, and we honor those things, but at the same time, Doug and I and the rest of our colleagues here have had a lot of experience with just the process here. So we're perfectly happy and willing to help guide you through this to the extent we can. And a couple of things that Eric, you mentioned, one is that the benefits that you can get through supplements, there's a lot of confusion around the gym membership issue. Many people refer to it as Silver Sneakers, but there are actually two organizations. There's Silver Sneakers and there's Renew Active. They're just private organizations that coordinate these gym memberships. And so when you sign up, it's actually your supplement that provides this benefit if they do it all. Some gyms will have an agreement with Silver Sneakers. Some will have agreements with Renew Active. Some will have agreements with both, and there are some that have neither. And so you have to, when you are vetting your supplements, if that benefit is important to you, make sure you know who they have an association with and in what gyms do that. The other thing I was, in my case, pleasantly surprised about is you can actually join more than one gym as long as the program you're in will accept that. So in my case, I've been gym hopping a little bit. I've got 4 gym memberships at different places around town, and they all accept it, and there's no premium for any of them. I talked to a representative at one of the organizations about that, thinking, is that true? Is that real? Their answer was, one, many people don't do that, but even if they did, as Doug mentioned earlier, this is all about cost savings and what's more expensive for them to pay for a subsidized gym membership for someone that even if it's 2 or 3 gyms, or they're not and they're getting themselves less healthy, and those incremental costs down the road are going to be far more. So they actually encourage this. But to clear that up, it is always through your supplement, and it's either Silver Sneakers program or Renew Active. So I urge you to check that. The other thing that Doug and I both experienced, and this was really important and really shocking, actually, we were both tackling the same issue with 2 different clients over 2 different periods of time. And that is to say, we mentioned about the getting enrolled in Social Security, or excuse me, in Medicare. When you do, you set the date that you want to begin, and then that date is aged, and typically they go through the vetting process, and then they give you that original date. But at some point in that process, they're going to give you a Medicare number. That Medicare number is your identifier. We were told, and we both were exploring this because we kept getting the same answer, and we just, neither one of us accepted it, which is pretty true to both of us. So we just kept working on this. And the bottom line was, in both of these cases, we had a situation where the Medicare process was slow. You have a date that you'd like to launch both the traditional A and B and the supplement. You can't get the process going, or at least we thought you can't get the process going for your supplement until you have that number. In the absence of that number, it delays you the starting period of your supplement. So in both of these cases, one more dire than the other. One was a matter of hundreds, maybe $1,000, and one, it was a question of several $1,000s. But in any case, we were told explicitly that that's the system. Well, we were both going at this from 2 different angles, but we both came to the same conclusion that what we've been told for over 25 years is just not so. You can actually, and you have to make a point of it when you apply for your supplement, we suggest you do, when they ask you for the Medicare number, you tell them either that you don't have it in front of you, or you say it's pending. With that pending app, they can go ahead and underwrite for the supplement, therefore your dates match up. Because in these cases, my date was my birth date, and the supplement didn't start to the next January. And with these 2 clients, there was a gap there where you went uncovered for the supplement. And in that gap, there were significant expenses for both of them that were going to be ignored if we didn't know that. So we both learned on it. And we actually talked to a few Medicare brokers that are seasoned brokers, and they didn't even know it. And since then, they've been actually employing that. So we think that's incredibly important.
Thanks, Tom. And we've actually gotten a couple questions kind of relating to age 65 coverage. If you are going to work past age 65, one of the questions was someone's turned 65 end of July, and he has healthcare through work, and he has until 10/31 to sign up for Medicare Part A. What happens if he doesn't do that? This is the question that was, and then another one was, are you required to enroll into Medicare Advantage, or can you remain in traditional Medicare? This was a P&G who is retired from P&G, and they feel like they're being forced into Medicare Advantage.
Okay.
So I do have a couple slides on this, so I'll cue those up. But Doug or Tom, you want to tackle that?
I'll jump on that one real quick. So post 65 enrollment, if you are covered by a qualifying creditable coverage, your special enrollment period, you have a special enrollment period, which is effectively your open enrollment period. It just moves as long as you are covered by a large group plan. Now, it's really important to understand what coverage qualifies. If you're in a plan that is not covered by COBRA, which basically is an employer who has 19 or fewer employees covered under the plan, then that does not count. Private insurance, COBRA, even if it's COBRA from a large group plan, does not count as creditable coverage. And anything that you get privately through the ACA or healthcare.gov, Obamacare, that doesn't count. So you need to make sure that if you're going to enroll after age 65, that you have qualifying coverage that will basically what's called tolling. It just keep moving your required beginning date as long as you have that that coverage. So you can move it. Now, a couple important issues there, and this can get complicated. We have a client in this situation right now. You have to get, when you enroll in Medicare, you then have to get letters or documentation of the creditable coverage for both the medical coverage. Eric's going to put that up there. You get a letter of creditable coverage. You need to watch out for that. They should automatically send it as soon as you terminate coverage, and you need that for your Part D coverage to enroll. And you need the flip forward, Eric, one to the CMS 40B, and that's the application for enrollment in Part B, and then CMSL 564. You need that form also attesting that you have creditable coverage. So these are all important elements if you're enrolling after age 65. But you
And Doug, that was one that my experience with that was also, I think you and I both know that I applied online for coverage, but then it got tangled up in the knot of, because I needed the L465, that I had to then get that form after it was signed by the employer's HR department, and then mix that with the 40B, which is really just the enrollment for Part B, the physical enrollment form. Then they asked that we send both of those on, even though I'd done an online enrollment. And that was another thing that held up my application, and nobody really told us that. So just, it's important, as Doug said, that if you're in that transition period and you're trying to make that transition, you're going to be asked to fill out the 40B, which might be redundant, and also to get the signed L465 signed.
Yeah. Thanks, Tom. That's great. I mean, I think all this comes down to, there are special circumstances if you plan to work past 65 that need to be taken special consideration for. So the size of your employer plan matters, and there's a special process for enrollment, and oftentimes it's going to in person to Social Security office. And again, processes change in the Medicare all the time. So.
Let me make this comment. The system is broken. Okay. As you try and navigate the system, we've been through this frustration point with many clients as they're going through the process. They're understaffed. They're not as trained as they need to be. They don't fully understand in every instance all of the circumstances. It does normally get fixed. Okay. I mean, I will say in general, it may take some patience. We've been through multiple scenarios. I have a good friend who we had to switch over due to a need for a transplant. And in that case, you absolutely want to be in traditional Medicare with a supplement. And switching from employer provided to a supplement, you know, there's all kinds of hoops to jump through. And then the one we haven't talked about yet, and we'll get back to that employer question of P&G, Eric. The other component of it is in the year that you retire and the year after you retire, because they're looking at your income from 2 years prior when you were working, you file a form that for a life-changing event to say, hey, I understand I had this income 2 years ago, but I don't have it anymore. That you can request a reduction in your IRMA, because a lot of times people were earning over the limit when they were employed. You can't apply or send that form in until you've already received the determination of what your IRMA is or what they think it should be. Because if you send it in prior, they're not going to match the two, right? And as Tom said, he got, I don't forget what it was, Tom, half a dozen different premium amounts, you know, over various iterations of the process. In almost every case, and you a lot of times have to do that both the year you retire and the following year. And if you worked a part of a year in the year that you retired, possibly even a third year of being covered under Medicare. It just takes patience and diligence. it's a process. As I said, the system on enrollment can be frustrating for everybody. And so it's a matter of where, I will say that on the premium and the IRMA amounts, ultimately, it does get worked out. If the facts are correct, you may have your premium adjusted 3 or 4 or 5 times along the way until they get it right. And they will credit back any overcharges you had earlier in the process. It's not like you have to fix it or lose it. They will retroactively correct it.
Yeah, and I believe, don't quote me, but I believe that form is S4, and we've helped many clients fill that out and submit that online. And any of these forms we can get access. We have on staff to help you guys navigate this process.
And I would concur with that, Doug. I think you're right. It does get addressed and fixed ultimately. And I will say, as much as it is broken, most of the time when you finally do get an agent, they're actually very caring and very helpful. So I want to give them a little bit of a shout out because they've got a tough job too, but there's noted exceptions to that. But most of the time they're very helpful, and they'll give you the same courtesy and time that they give others that keep you on hold for so long.
And a lot of times the easiest way to solve it is to get all the information together, which we help clients gather, and just simply go into the local office, set up a time and sit down with a live person who in many instances has the ability to fix it on the spot.
Which COVID completely disabled for a long time.
For a couple of years.
Really unfortunate.
Awesome. So we'll try and rapid fire through a few of these questions, keep them really brief. The first one, the $544 IRMA, is that monthly?
Yes.
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 And Eric, someone asked the P&G question. Can you repeat that one? Because I don't think I answered it.
And it's $585, Eric.
$585, yes. So let's see here. What was that one? Are you required to enroll into medical advantage, or can you remain on traditional Medicare? I hear those retiring or have retired from P&G were forced to adopt Medicare Advantage.
So P&G has a hybrid Medicare Advantage plan as their retiree health plan. So if you're going to use their plan, it is a hybrid plan. So that is part of, and that can be what's all you have available. The situation I gave with my father-in-law, he's a retired teacher from STRS, and he made his election 20 some years ago, and he went with the STRS Medicare Advantage plan, and he can't get out. So again, once you're in it, then yes, that can be difficult. Now, and again, sometimes if it's being paid for, it's an issue of people just take it because of cost.
So we may want to check in too for those who travel that have a Medicare Advantage plan.
Yeah, that's a good point. So Medicare Advantage, for our clients that have homes in Florida and homes or had homes in Florida, I should say, prior to Ian, sometimes traditional Medicare is superior because of the flexibility. If people claim residency in Florida for tax reasons as part of their planning, then you have to take a network and a plan that's in Florida, where your state of residence is and the county of residence, and it may have very limited benefits up here. There are Medicare Advantage plans with national networks. So, I mean, these are all circumstances we would sit down with clients and go through all of the issues individually and help you determine which one's appropriate.
Go ahead, just as a point of reference too, in any emergency, that's not so much the case. We're talking about other issues that happen while traveling.
Yeah. And the other thing I will point out, traveling internationally, there's very limited benefits in traditional Medicare for international outside of emergency care. So if you travel internationally, it is always a good idea to get a health supplement that are available in case you have a hospitalization. And we had a client who actually had an issue in Ireland, and it took us, I don't know, a year to get it straight. We ultimately got it reimbursed and paid. But that can be important. That can be really, really important.
Okay. What about dental coverage?
So dental coverage through Medicare is lousy. Whether if you take the embedded plans, for the most part, they're very limited. Chances of your dentist being in it are almost zero if they're embedded in a Medicare Advantage plan. And the benefits are very, very limited. They might have $1,000 maximum coverage. You might have prophylactic care. So you can also enroll now in a separate dental plan. Again, very limited benefits. I encourage, there are now a lot of dentists have gone to basically offering a club plan or a cash discount plan that effectively is the same as what the Medicare benefits are under dental plans. They're just not, in most cases, not worth using.
Awesome. So we do have a couple extra questions. We have the individuals will reach out to you individually that we don't have time to get to today. We also didn't talk in depth about the Part D coverage, but that's a conversation on your medications that we will have with you at the point that you're getting ready to enroll.
Eric,
So,
can I give 20 seconds on that?
20 seconds.
On Part D. So on Part D, this is drug coverage. And if you want to go to that drop down real quick, Eric. Part D plans have a deductible, varies by plan. Then they have an initial coverage period where you're paying usually a fixed cost for branded or for generics. Then you get to what's called the donut hole, where you're responsible for 25% of the cost of the drugs until the total drug spend hits a maximum out of pocket. And then from there, you hit catastrophic coverage. This is critical to understand whether drugs you're taking are on the formulary list for your provider. And it's also important to understand how that is handled, because when you get in the donut hole, it can get very expensive. But drug providers, drug companies offer substantial discounts on that 25%, that drug that you have to pay 25% of. And the discount they give you counts towards your out-of-pocket spending. So if the drug is $500 and you're spending $125 and they're giving you a $350 discount, that $350 discount does count towards your out-of-pocket spending. So this is an important issue to understand. And again, something we can step through with you on in more detail on your individual circumstances.
And a quick note, some of that coverage and the donut hole piece is set to change and actually reduce in 2024 and 2025. And so we'll have continued conversations on that with those as you approach that question, as well as all of Medicare. Last piece, wanted to obviously thank everyone for joining today. We'll continue to have these conversations during our planning process. Real quick, how Wealth Dimensions helps. Obviously, the education piece and individualized direction as part of your planning process. And as you're approaching 65, we'll have these conversations and individualize your plan for you and your spouse. Also, we do professional referrals. As I said, we're not Medicare agents. We don't sell products in this space, but we do have partners and trusted contacts that can actually do the enrollment and sell Medicare supplement and Medicare Advantage plans. And then lastly, we plan for the IRMAs. As you saw, it can be very expensive in retirement. That's a process we help people plan for, building different buckets of wealth inside of your financial plan to be able to draw income in a tax efficient way in retirement, taking into consideration what you're going to pay for Medicare as far as the IRMA and the premiums go. And then just general medical expenses and Medicare expenses. We plan for those years in advance inside of your plan. We build that in. I have, for myself and some of the G2s, as we like to call them, the young professionals in their 30s, we have the Medicare expenses already built into a plan. We don't know what it's going to look like at that point, but we are covering that cost because medical and dental costs in retirement is one of the biggest drains on some people and unforeseen costs that happen. So just wanted to make a quick note of how we help on that. And as you're planning for this process, please feel free to reach out and we can have individualized conversations on this. So thanks to everyone for joining. Hope you enjoyed the content. Please give us feedback. And also please stay tuned for the videos and blogs and all the other things we're putting out on socials as well as email. If you're not receiving some of those, please reach out and we'll find a way to get you connected. Thanks everyone for the time.